From mid-March to today, June 18th, the coronavirus epidemic in the US has reached 2 million cases, has surpassed 100,000 deaths, and has left more than 40 million people temporarily unemployed. These statistics are staggering, and we are still absorbing the magnitude of this crisis. Social disciplines are reflecting on the impacts of this pandemic and have made use of historical cases for guidance as to what is still to come and possible scenarios based on past epidemiological trends. And all these books are selling very well in Amazon.
Paleomicrobiology is transforming what we know about ancient pandemics. But archaeologists have to find, identify, and interpret human remains before paleomicrobiologists can get started. Archaeologists play a fundamental role in gathering data that other scholars use to build the case for an ancient pandemic. Mass graves are often the first clue that epidemic disease has occurred. Next slide, please. As the Viking burial suggests, the age and sex of burials can distinguish disease victims from other types of mass death. The mass grave of disease victims would be very different from the all-male Viking pit. As we know well from our own situation with COVID-19, diseases do not strike every age group and both sexes with similar intensity. COVID deaths are much higher for people over age 60 and somewhat higher for males. This image shows the 1918 Spanish flu pandemic that killed many, many young adults. In this figure, the flu profile is compared with a normal flu season 10 years later that had much different age profile, and that's the one in green. Bioarchaeologists have found similar differences in demographic profiles from ancient disease victims. For example, scholars in Europe have found that more adults died of cholera than other age groups, while plague more commonly struck down children and adolescents as well as adults. Next slide. Once all the data about a mass burial is gathered, archaeologists can be fairly confident when they categorize the victims as having died of an ancient epidemic. Then paleomicrobiologists can take over to identify which disease agent caused the death. Okay, next slide. So what I want to emphasize today is the social factors that made native mortality so much greater. Next slide, please. Our current COVID-19 pandemic is bringing out some uncomfortable truths about the United States. Poor people and people of color are dying in greater numbers than people who are wealthier and white. In the US, the highest per capita rate of infection for COVID is on Indian reservations. In other words, your chances of death may have much more to do with your social position than with your resistance to disease. But during the European conquest of the New World, the high death toll among Native American communities was not only due to disease, it was also the result of the brutality of colonization. Native Americans were attacked, enslaved, overworked in industries like mining, their crops and land were appropriated, their communities were either co-opted or dispersed, or they were herded into mission settlements. For these reasons, indigenous immune systems did often become compromised, and the breakup of indigenous communities destroyed native medical knowledge and dispersed caregivers, making any disease episode that much more disastrous.
So despite the fact that we still have a very limited understanding of the history of infectious disease in association with humans, the leading theory suggests that pathogens really started becoming more frequent among human populations during the Neolithic period. And it is in the Neolithic period that is when humans began to live in settlements and also began to explore and manipulate the environment around them more intensely. And it is also the period when humans started to domesticate plants and animals. And it has been suggested that the frequent contact or the increasing contact of humans with animals could have provided additional opportunity for humans to be able to acquire infectious diseases through zoonotic transmission. And so this is when animals can transmit disease to humans. But during that time, it is also when humans started living in more closer proximity with each other. So when actually we have a more sedentary lifestyle and bigger settlements compared to the previous periods. And it is actually this closer contact also among humans that is suggested to actually have caused perhaps the first epidemics among human populations. So the analysis of ancient DNA is a highly specialized process that entails the extraction of DNA from archaeological or paleontological remains. But perhaps equally important is that it requires highly specialized computational methods for the separation and authentication of this DNA from a highly complex mixture that stems from from the environment where these remains have been preserved. So what this means is basically that when we extract DNA from a human specimen, the majority of the DNA that is extracted actually stems from environmental microbes. So more than 99% of this DNA stems from the environment, and therefore we have to use computational techniques to really be able to separate the ancient pathogen DNA and also authenticate it based on the typical ancient DNA damage compared to modern DNA that would be the contaminant DNA in this case. What we have done during the last 5 years or so is to analyze multiple cemeteries from that time around Europe. And we've been able to identify Yersinia pestis from multiple of these cemeteries, both from regions where we have historical records of the disease, but also from areas where no historical records of the disease survived until today. So what this shows us is that first we can find evidence of Yersinia pestis from Europe during that time, suggesting that indeed this first pandemic was caused by plague. And second, that we are able to enrich the historical record by identifying evidence of the bacterium in places where no historical records of the disease are identified until today. Last, we were able to identify a diverged lineage of strains that were present in Europe between the 6th and 8th centuries AD.
There is one question that are asking, please speak to the role of academics in affecting policy change, especially talking about all these vulnerabilities that increase the risk of having outbreaks. And look, one thing is to know, and we know a lot, but it is not enough to know. We need to communicate, and we need to be very politically active. I think academics are kind of like, they don't want to participate in political life too much. And there is no time, actually. I think it's like our systems are organized in such a way that we don't have time to do that. But we need to have or find the ways to communicate our findings and our knowledge to the political system. Because if we don't do that, even if we know, it is not going to help at all. So these kind of forums in which we are aware that it's not only about the pathogens, but it is about the way we structure our societies, and that we need to change things in our societies to reduce inequalities. That's the only way in which we are going to help. And we need to communicate this in a very vocal way to our politicians. Kathy, do you have any?
100%.